Hi, I'm Dr. Chinyere Ugorji, 2007 graduate of American International School of Medicine with 10 years of clinical experience working as a certified nurse aide from my clinical rotations here in the United States from 2 graduate medical education programs, for the internal medicine residency program, Detroit, Michigan, and Springfield Family Medicine residency program, Springfield, Illinois, from various observerships and externships, from my various preventive health fairs, where I've had the opportunity to have hands-on experience from, and a master's in business administration with an emphasis on public administration from Davenport University, Grand Rapids, Michigan, and some research experience from UT Southwestern, working with Dr. Carolina and Ghana Downs, who are both awesome people. And I'm currently involved in education and mentoring of healthcare professionals, and in preventive health practice, where I provide free medical care and counseling to victims of depression, mood disorders, and sexual abuse, which I haven't experienced personally, but most of the patients I've seen in my practice. I'll be talking on cystitis or urinary tract infection today. I'm doing a brief broadcast today because I don't really have the media equipment to be able to do a full broadcast, and I apologize for that. So cystitis, what is that? That's something that you might want to ask. Well, it's an infection that affects part of the urinary tract, and what causes it? Well, it's a bacteria called E. coli, and that is the cause in most cases, 80 to 85% of urinary tract infections. And in 5 to 10%, a bacteria called Staphylococcus aureus, Staphylococcus saprophyticus is actually the cause. Now, what are the symptoms? Well, if you have painful urination, if you have frequent urination, or if you have an urge to urinate, if you have fever, if you have flank pain, if you have nausea and vomiting, if you have change in mental status or fatigue, then it's possible that you might actually have a urinary tract infection. So how do you find out? What is the diagnostic test? Well, urinalysis, it's a test called urinalysis, where the physician tests your urine, and they check to see the components. And also, by doing a urine microscopy, you can be able to look at the cells, are there any white cells which are significant for an infection? Are there any red cells? So with a microscopy, they can be able to know all of that. And then urine culture, they can be able to pinpoint what is the exact bacteria that's causing this problem, so we can be able to treat it. Now, what is the treatment? Well, antibiotics is the mainstay of treatment, and that includes an antibiotic called trimethoprim, sulfamethoxazole, cephalosporin, nitrofurantoin, and also fluoroquinolone. So those are classes of antibiotics that can actually be able to be used to treat these infections. References, it was from an article on Wikipedia. So I have a quiz here that is actually designed to encourage active participation, because I'm actually trying to see, to get people to share their case studies, to get them to be able to come to my practice, so I can be able to refer them to the appropriate healthcare professionals. So how do we get that? I have a quiz that is actually designed to encourage active participation. So the first one is oral antibiotics are a way of treating urinary tract infections, true or false? Well, the answer is true. Oral antibiotics are a way of treating urinary tract infections, like we talked, and the options are trimethoprim, sulfamethoxazole, cephalosporin, nitrofurantoin, or fluoroquinolone. So number 2, urinalysis are a way of diagnosing a urinary tract infection, true or false? Well, that's actually true. You diagnose a urinary tract infection by looking at the components of the urine, and that's done with a urinalysis. I have a Powerball question. So far we've done 3 topics this week. So the Powerball questions are actually going to be done on Saturday when I do my broadcast for my charity work, the work for the human informer called Light and Night Work, and prizes that are going to be given out. I still have a rhapsody for Jimmy Abimbo, who is on my team, who was the person that won the Powerball for the last series that we just finished. So the follow-up question is E. coli is the major cause of a urinary tract infection, true or false? So I'll let you check that out from the article. All the answers are actually on my in the article and also on my webpage. I'm also going to be I'm bringing you some more features for healthcare professionals coming up soon. But this broadcast is mostly for the patients in my who are following my broadcast, and also designed to enhance my preventive health practice. And I'm also having a preventive health fair coming up on Saturday, and that will take place every Sunday. I'm sorry, every Sunday till back to school. So it's like a back to school health fair where I'll be providing free health care for students, and all the information is on my website. I invite you to check it out and get back to me via email, social media, my phone number.